If you've ever wondered what it's like to have an ingrown toenail removed, this is the video for you. This patient actually had ingrown toenails on both of their great toes. You can see we're working on the right one here, and what you're looking at has a granuloma associated with it, which is inflammation of the skin tissue that's next to the ingrown toenail. And you can see we're putting a tourniquet on here. That's what that green band is that we're putting on the toe. And that's going to exsanguinate, which means to push all of the blood out of the toe so that while we are working, we don't have a lot of drainage of blood, which can make the surgical procedure a little bit messy. And if we're inserting a chemical in there called phenol to stop the growth of the toenail, which we're not doing in this particular patient, you'd want that blood flow to be minimal so that the chemical can work. But this patient actually has a mild infection going on, so we're going to do what's called a nail avulsion, and we're only going to remove a portion of the toenail, and we aren't going to put any chemical in there. So you can see what we did was we freed up the tissue around the toenail to then get ready to cut the toenail, which we just did there with a 62 blade. That's a small scalpel blade that's like a chisel. And then we use a hemostat to pull that ingrown toenail out. And that's what we did there. Now, the remaining inflammatory skin that I called a granuloma, we're going to excise away. That's what we're doing there, removing that excess inflammatory tissue. And you can see the nail fold where the toenail was. And we're going to put an antibiotic ointment on there, bandage up the toe, and then move on to the other toe. So this patient, as I said, came in having this happen on both of their great toes. And when they're a little bit inflamed like this or infected, or if this is the first time they've ever had this happen, maybe they cut their toenail crooked or they were wearing some tight-fitting shoes and it caused the toenail to become ingrown, we're just going to perform a temporary procedure. So here we are on the opposite foot. You can see the same situation happened. We have a granuloma forming, and the ingrown toenail has become hidden under that granuloma, so the patient wasn't able to cut it out themselves. Sometimes they can get to it. I don't recommend doing this when they get this inflamed and partially infected like this. You want to make sure you get the whole toenail out, because what can happen is you can cut a portion of that nail and you create a little spike, and then that spike will keep growing into the nail fold and it'll sometimes push out of the toe. So we're going to do the same thing. We clip a portion of that nail plate, and then we will split the nail with a 62 blade. And this doesn't have to be as perfectly cosmetic as a matrixectomy procedure, because that nail corner will grow back. All we're trying to do here is remove the offending nail plate that's growing into the tissue. I'm clipping the end of the toenail just to get some of that pressure off the edge, because when you get these infections, the toe itself will swell up, and when it swells, you can sometimes get a ingrown toenail on the opposite side of the toenail because the skin becomes swollen, it pushes on the toenail. So you can see we're removing that ingrown portion, and the granuloma remains. We're going to excise that granulomatous tissue with our nail nippers. And then we're going to do the same thing. We'll put our antibiotic ointment on there and a gauze bandage, and the patient will be done. So we numbed the toes before doing this. So if you're worried that this is going to be a painful procedure, it's not. The toes get injected with lidocaine and marcaine, which are anesthetic agents. And this is all done in the office. They'll keep this bandage on for about 24 hours, and then the next day they soak it in warm water and Epsom salts, or they can use warm water and antibacterial soaks. And then that bandage will come off. Typically, they'll remove the bandage after soaking it the first time because it gets moist and it comes off very easy. And then they'll just use a Band-Aid and Neosporin for about a week, sometimes 2 weeks. It all depends on how infected or inflamed it was. That will dictate how long they actually have to keep bandaging it. But once it starts to dry up, they're done. You don't need to let these air out. Surprisingly, a lot of patients think you want to let a wound air out. You actually don't. You want to keep it moist with an antibiotic ointment or even sometimes Vaseline just to keep it moist, and that will promote a healthy wound healing environment. So if you have any questions about ingrown toenails, feel free to ask them in the comments section below. Thanks for watching.